If you're over 50 and you've ever taken those first few steps out of bed in the morning only to feel a sharp stabbing pain in your heel or along the bottom of your foot, you know exactly how frustrating and limiting that can be. That pain can make you dread getting up, and it can turn simple activities like walking to the kitchen or stepping outside to get the mail into something you have to mentally prepare for. For those of us in our 50s, 60s, 70s, and beyond, this kind of foot pain is surprisingly common, and the good news is that there are some gentle, simple techniques that may help provide relief. Today, I'm going to share a quick 30-second routine along with several other supportive habits that many people find helpful for easing heel and arch discomfort. We'll go step by step, nice and slow, and I'll give you easier options along the way if you need them. Hello, my friend, and welcome back. I'm Dr. Sarah Truman. Before we dive into today's topic, I want to be very clear about something important. I'm a health coach and wellness educator who specializes in helping seniors stay active and independent. I am not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before starting any new exercise, changing your daily routine, or trying any of the techniques I mention, especially if you have any health conditions or take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. This is especially important when it comes to foot pain, because there can be many different causes, and what works for one person may not be right for another. So please, keep your healthcare provider in the loop. Now, let's talk about what we're covering today. We're focusing on heel and arch pain, which is often associated with a condition called plantar fasciitis. I'll explain what that means in just a moment. This type of foot discomfort affects millions of people, and it becomes more common as we get older. It can really impact your quality of life, making it harder to stay active, enjoy walks, or even just move comfortably around your home. Today, I want to help you understand what might be happening in your foot and, more importantly, share some gentle, practical techniques that may help you find some relief. Here's what we'll cover. First, I'll explain what plantar fasciitis is and why it tends to affect people over 50. Second, I'll teach you a simple 30-second stretch that many people find helpful for morning pain. Third, we'll go through some additional stretches and movements you can do throughout the day. Fourth, I'll share some tips about footwear and simple lifestyle adjustments that may support your feet. Fifth, we'll talk about common mistakes people make when dealing with this kind of pain. And finally, I'll let you know when it's important to see a doctor. Let's get started. So what exactly is plantar fasciitis and why does it happen? Let me explain this in simple terms. On the bottom of your foot, there's a thick band of tissue that runs from your heel bone all the way to your toes. This band is called the plantar fascia. Think of it like a strong, supportive rubber band that helps maintain the arch of your foot and absorbs shock when you walk. Now, over time, this tissue can become irritated, inflamed, or develop tiny tears. When that happens, you often feel pain right at the bottom of your heel, or sometimes along the arch of your foot. The pain is usually worst when you first get up in the morning or after you've been sitting for a while. That's because when you're resting, the tissue tightens up, and then when you take those first steps, it gets stretched suddenly, which can cause that sharp stabbing sensation. Why does this happen more often as we get older? Well, there are several reasons. First, the plantar fascia naturally loses some of its elasticity as we age, just like other tissues in our body. It becomes a little less flexible and a little more prone to irritation. Second, the fat pad on the bottom of our heel, which acts as a cushion, tends to thin out over the years. This means there's less natural padding to protect the heel when we walk. Third, many of us have spent decades on our feet, and all that accumulated stress can add up. Finally, changes in how we walk, our activity levels, and even our weight can all put extra strain on this area. The important thing to understand is that this is very common. You're not alone in experiencing this. Millions of people deal with plantar fasciitis, and the good news is that for many people, simple self-care techniques can make a noticeable difference over time. Small, consistent efforts often lead to gradual improvement, Now let's get to the first and perhaps most important technique I want to share with you. This is a simple 30-second stretch that you can do first thing in the morning before you even get out of bed. Many people find that this one small habit helps reduce that sharp morning pain. Here's how it works. When you sleep, your foot naturally relaxes into a pointed position and the plantar fascia tightens up. Then when you stand up and put weight on your foot, that tight tissue gets stretched suddenly, which is what causes that awful stabbing pain. By gently stretching the tissue before you get up, you can help prepare it for the day ahead. Here's what I want you to do. When you wake up in the morning, before you swing your legs out of bed, sit up slightly and bring one foot towards you so you can reach it comfortably. If you can't easily reach your foot, that's okay. You can use a towel, a belt, or even a long sock to help. First, wrap the towel or your hands around the ball of your foot, just below your toes. Second, gently pull your toes back toward your shin. You should feel a stretch along the bottom of your foot and possibly up into your calf. Don't pull hard. This should be a gentle, comfortable stretch, not painful. Third, hold this position for about 30 seconds while breathing slowly and deeply. Fourth, release and repeat on the other foot if needed. That's it. 30 seconds. Some people like to do this 2 or 3 times on each foot before getting up. The key is to be gentle and consistent. Don't yank or force anything, just a nice, easy stretch. Now here's a modification if reaching your foot is difficult. You can do this same stretch while sitting on the edge of your bed with your foot flat on the floor. Simply lift your toes off the ground while keeping your heel down and use your hand to gently pull your toes upward. Or place the towel under the ball of your foot and gently pull up on both ends. Find whatever position works best for your body. A word of caution: if this stretch causes sharp pain, stop immediately. Some mild tension is normal, but you shouldn't feel a sharp or stabbing sensation during the stretch. If you do, ease up or skip it and mention this to your healthcare provider. This simple morning stretch is something you can do every single day. Many people notice that over several weeks of consistent practice, their morning pain gradually becomes less intense. Be patient with yourself. Healing takes time. Now that we've covered the morning stretch, let's move on to some additional stretches and movements you can do throughout the day to keep that plantar fascia and the surrounding muscles more flexible and comfortable. The second technique I want to share is a calf stretch. This is important because your calf muscles connect to your heel through the Achilles tendon, and tightness in your calves can actually contribute to plantar fascia strain. By keeping your calves flexible, you may help reduce some of the pulling and tension on the bottom of your foot. Here's how to do a gentle standing calf stretch. First, stand facing a wall with your hands placed on the wall at about shoulder height for support. Second, step one foot back about 2 feet, keeping that back leg straight and your heel firmly on the ground. Third, bend your front knee slightly and lean your body gently toward the wall until you feel a stretch in the calf of your back leg. Fourth, hold this position for about 30 seconds, breathing normally. Fifth, switch legs and repeat. If standing is difficult for you or you feel unsteady, you can do this stretch while sitting in a sturdy chair. Simply extend one leg out in front of you. Flex your foot so your toes point toward the ceiling and use a towel around the ball of your foot to gently pull your toes toward you. This stretches both the calf and the plantar fascia. Another helpful movement is what I call the towel scrunch. This simple exercise can help strengthen the small muscles in your foot, which may provide better support for your arch over time. Here's how to do it. Sit in a chair with your feet flat on the floor. Place a small towel flat on the ground in front of you. Using only your toes, try to scrunch the towel toward you, grabbing it with your toes and pulling it in. Then push it back out and repeat. Do this for about 1 to 2 minutes if comfortable. This might feel a little strange at first, and your foot might even cramp a little. If that happens, just stop and rest. Start with just 30 seconds and gradually work your way up as your foot gets stronger. A third movement that many people find soothing is rolling your foot over a frozen water bottle or a tennis ball. This can provide a gentle massage to the plantar fascia while also helping to reduce inflammation. Here's what to do. Fill a plastic water bottle about 3/4 full and freeze it. Alternatively, you can use a tennis ball or even a rolling pin. Sit in a comfortable chair and place the bottle or ball under your foot. Gently roll your foot back and forth over the object, applying light to moderate pressure. Focus especially on the area from your heel to the middle of your arch. Do this for about 2 to 3 minutes on each foot. The cold from the frozen bottle may help reduce inflammation, while the rolling motion provides a gentle stretch and massage. If the cold is too intense, you can use a room temperature bottle or tennis ball instead. Remember, all of these stretches and exercises should feel comfortable. A little tension or mild discomfort is normal, but sharp pain is your body's signal to stop. Listen to what your body is telling you. Now let's talk about something that makes a big difference for many people, and that's your footwear. The shoes you wear can either support your feet or contribute to more strain and discomfort. Let me share some tips that may help. First, consider the support your shoes provide. Many people with plantar fasciitis find relief when they wear shoes with good arch support and cushioning, especially in the heel area. Look for shoes that don't bend too easily in the middle. When you pick up a shoe, it should feel relatively firm and supportive, not flimsy or floppy. Second, avoid going barefoot on hard surfaces, especially first thing in the morning or after sitting for a while. I know it might feel nice to pad around the house without shoes, but walking barefoot on hard floors can put extra strain on your plantar fascia. Many people find it helpful to keep a pair of supportive slippers or sandals right next to their bed so they can slip them on before taking those first steps. Third, consider your shoe age. If your everyday shoes are worn out with flattened cushioning or uneven soles, they may not be giving your feet the support they need. Most walking shoes should be replaced every 300 to 500 miles of walking, or roughly every 6 to 12 months if you wear them regularly. Fourth, some people find relief with over-the-counter arch supports or heel cushions that can be placed inside their regular shoes. These inserts can provide extra cushioning and support. There are many different types available, so you might need to try a few to find what feels best for your feet. If simple inserts don't help, your doctor might recommend custom orthotics, which are specially made to fit your unique foot shape. Fifth, pay attention to the heel height in your shoes. Very flat shoes, like certain sandals or ballet flats, offer little support and can strain the plantar fascia. On the other hand, very high heels shift your weight forward and can cause other problems. A shoe with a slight heel elevation of about 1 inch often provides a good balance for many people. Finally, if you're doing any exercise, make sure you're wearing appropriate shoes for that activity, walking shoes for walking, and if you're doing any other types of movement, wear footwear designed for that purpose. Proper footwear can make a real difference in how your feet feel. Let's move on to some lifestyle adjustments that may help support your foot health overall. First, consider your activity levels. If you've been very sedentary, gradually increasing your movement can help improve circulation and support healing. However, if you've been overdoing it with high-impact activities, giving your feet a bit more rest may be what you need. Finding the right balance is key. Second, gentle, low-impact activities tend to be easier on the feet than high-impact ones. Walking on soft surfaces like grass or a track, swimming, water aerobics, or cycling put less stress on your plantar fascia than running or jumping activities. If you're experiencing significant pain, you might consider temporarily switching to lower-impact activities while your feet recover. Third, maintaining a healthy weight can help reduce the load on your feet. Every pound of body weight puts several pounds of pressure on your feet when you walk. I know weight management can be challenging, and I'm not here to lecture you about it. But if you're working on this aspect of your health, know that it may also benefit your feet over time. Fourth, some people find that gentle massage, either self-massage or professional massage, helps improve circulation and reduce tension in the foot and lower leg. You can massage your own foot by rubbing your thumbs along the arch and heel area, using gentle to moderate pressure. Do what feels good and stop if anything causes pain. Fifth, some people find that icing the bottom of their foot for 10 to 15 minutes after being on their feet a lot can help reduce inflammation and provide temporary relief. You can use a thin cloth between the ice pack and your skin to prevent ice burn. This is especially helpful at the end of the day if your feet have been working hard. Now, I want to address some common mistakes and myths about heel and arch pain that I hear quite often. The first mistake is ignoring the pain and pushing through it. Some people think that if they just keep going, the pain will eventually go away on its own. While minor aches sometimes do resolve, consistently ignoring significant foot pain can actually make things worse over time. The plantar fascia can become more irritated, and what started as a minor issue can become a chronic problem. It's important to listen to your body and take action early. The second mistake is doing too much too soon. When people start feeling a little better, they sometimes jump right back into their normal activities at full intensity. This can re-irritate the plantar fascia and set you back. If you're starting to feel improvement, increase your activity levels gradually. Give your body time to adapt. The third myth I want to address is the idea that you need complete rest to heal. While reducing aggravating activities is important, total immobility isn't usually the answer. Complete rest can actually lead to more stiffness and weakness. Gentle stretching and appropriate movement are generally part of the recovery process for most people. Another myth is that surgery is the only solution. For the vast majority of people with plantar fasciitis, conservative approaches like the ones we've discussed today are effective. Surgery is typically only considered after many months of other treatments haven't helped, and even then, it's not always necessary. Research suggests that most people experience significant improvement within 6 to 12 months with consistent self-care. Finally, some people believe that once you have plantar fasciitis, you'll always have it. While it's true that this condition can be stubborn and may come back, many people do find lasting relief with proper care. The key is consistency. Continuing to stretch, wear supportive footwear, and take care of your feet even after the pain improves can help prevent future flare-ups. Before we wrap up, I want to talk about when it's important to see a doctor about your heel or arch pain. While the tips I've shared today may help many people, there are certain situations where you should definitely seek professional medical advice. Please see your doctor if your pain is severe or getting worse despite trying self-care measures for several weeks. See your doctor if you have significant swelling, redness, or warmth in your foot, as these could be signs of an infection or other condition. See your doctor if you have numbness, tingling, or burning sensations in your foot. See your doctor if you have a fever along with foot pain. See your doctor if you have difficulty bearing any weight on your foot. See your doctor if your pain started after an injury or trauma to your foot. See your doctor if you have diabetes or any condition that affects circulation or nerve function in your feet. And please see your doctor if you simply aren't sure what's causing your pain. Your feet are incredibly important for your independence and quality of life. If something doesn't feel right, it's always better to get it checked out. Your healthcare provider can properly examine your foot, possibly order imaging if needed, and rule out other conditions that might be causing your symptoms. They can also recommend treatments that I haven't discussed, like physical therapy or other medical interventions that might be appropriate for your specific situation. Let's quickly recap what we covered today. First, we talked about what plantar fasciitis is and why it commonly affects people over 50. That thick band of tissue on the bottom of your foot can become irritated and inflamed, causing heel and arch pain, especially first thing in the morning. Second, we learned a simple 30-second stretch you can do before getting out of bed each morning. Gently pulling your toes back toward your shin helps stretch the plantar fascia and may reduce that stabbing morning pain. Third, we covered additional stretches and exercises including calf stretches, the towel scrunch exercise, and rolling your foot on a frozen water bottle or tennis ball. Fourth, we discussed the importance of supportive footwear, avoiding barefoot walking on hard surfaces, and considering arch supports or cushioned inserts. Fifth, we talked about lifestyle factors like balancing activity and rest, choosing low-impact exercises, and using ice when helpful. And finally, we covered common mistakes to avoid and when to see your doctor. Remember, you don't have to do everything at once. Start with one small change that feels manageable, maybe just the morning stretch, and build from there. Consistency is more important than doing everything perfectly. Small steps add up over time, be patient and kind with yourself. Healing from plantar fasciitis often takes weeks or even months. Progress might be slow, but for many people, gradual improvement does happen. Everyone's body is different, and your journey will be unique to you. If you found this video helpful, I'd be so grateful if you'd give it a thumbs up. It helps other seniors find this information too, and that means a lot to me. And if you're not subscribed yet, consider joining our community. I share new videos every week focused on helping you stay strong, healthy, and independent as you age. If you'd like to keep going, I recommend watching my video on simple balance exercises for seniors next. Strong, stable feet are an important part of maintaining your balance and preventing falls. I'll put the link on screen and in the description so you can find it easily. Thank you so much for spending this time with me today. Take care of yourself, be gentle with your feet, and I'll see you in the next video.